Welcome to the Medical Staff Voice Live. I'm Dr. Stan Frosweig, Chief Medical Officer at Community Memorial Health System. And I'm joined today by Dr. Michael Poon, urologist. Welcome, Dr. Poon. Nice to have you here.
Thank you for having me.
It's my pleasure. We really appreciate you joining us so our medical staff and community can learn more about your practice. In order to do so, we have a few questions that will help clarify who you are and enlighten us as to the nature of your practice. First of all, let's get an idea of where you're from. What brought you to Ventura? What is your training? Can you give me an idea of that?
Yeah, sure. I was born and raised in Los Angeles, grew up in the San Gabriel Valley, went to college at Loma Linda University, got my medical degree at the University of Southern California. And I was actually originally training as a general surgeon at the LA County USC. I decided to change to urology and went back to Loma Linda. And over there, my chief resident was Dr. Marc Beaghler, who is a urologist here forever and ever. And he's been actually trying to get me out here for the past 20 years. And so now that my youngest went to college, I took the bait last year, and here I am.
How fortunate we are to have you here. Thank you so much. You practice general urology. You do have certain areas in which you have particular interest. Can you explain to both our medical staff and to the public at large, what are those treatments that you find most interesting to you, most pertinent to what patients should know?
Yeah, I focus my practice on adult urology. At our offices, we treat a variety of conditions, urinary complaints, kidney stones, prostate and kidney cancers, including minimally invasive treatments for prostate symptoms, including urolift. But my area of subspecialization or expertise is robotic surgery for kidney or prostate cancers.
Well, that's, of course, really cutting edge medicine and science nowadays. So we're very fortunate to have you be able to provide that, because I remember years back, we used to send people down to LA for that. And we no longer have to do that now for quite some time. Do you find yourself fairly busy with that?
Yes. I've become, as I've been in a community longer, again, the population's growing. People are living longer. The primary care does an excellent job of screening for cancer. So yes, it's been very busy.
Good. You said something important from my perspective, in that primary care does do the screening very often. How important is prostate PSA cancer screening?
It's very important. What I love is talking about PSA with patients, because it's probably one of the most misunderstood screening tests. So what I tell patients is PSA, or prostate specific antigen, is just a protein that measures our prostate activity, and it can be elevated in prostate cancer. But it is not a yes-no test like a pregnancy test. It just lets us know who we need to get a little bit more information. And if still suspicious, then we do a prostate biopsy to see if we have prostate cancer.
That makes a lot of sense. I know there's been some controversies in years past, federal government thinking that maybe we don't need to do PSA testing past a certain age. That's a good question, actually. I'll often tell patients, I don't base your condition on your chronological age, because some people live well into their 90s and beyond. Is there a particular time we should definitely stop PSA testing or delay it until a particular time?
Yeah, you bring up an interesting point, because what I tell patients is scientifically, the value of continuing to screen for prostate cancer beyond 70 or 75 is uncertain. But the one thing I learned in my year out here is that people here live a really, really long time. So to what you alluded to earlier, the U.S. Preventive Task Force did not recommend PSA screening. So what happened was everyone stopped screening for prostate cancer. And within a few short years, the incidence of metastatic prostate cancer went up extremely high, and they reversed that. So really, it's about just having an informed discussion on the pros and cons of PSA testing.
Very nicely said. I would have to say that probably one of the biggest problems men present with in my practice is enlarged prostates. Could you explain how you manage a little bit those enlarged prostates and the urinary flow issues that many men experience?
Yeah, sure, absolutely. What I tell my patients is I start with the basic physiology lessons. Our kidneys sit there, they constantly filter blood to make urine to fill our bladder, and our bladder has to fill up and our prostate relaxes and we push the urine through. So as we age, that channel gets more narrow. So I tell them to think about blowing or drinking through a small, narrow straw versus a very large straw. That's what BPH is. And the other piece is the bladder. As we age, our bladder doesn't store as much, so we have to go more often. And when it wants to empty, it doesn't care that we're in line at the supermarket or driving on the freeway. It makes it feel like a big emergency. So in general, men can start simply if they have potential symptoms of prostate enlargement with herbal supplements like saw palmetto. The data's a bit, plus minus, but there's no harm in that. Mm-hmm. And then, of course, if still bothersome, there's prescription medication. And we usually perform a basic in-office evaluation to make sure there's nothing else going on, strictures, bladder polyps, or bladder stones.
Mm-hmm. Makes sense. That's very, very helpful. Just so I understand, urology is what you do and what you occupy your life with substantially, both in office and in the operating room. What are you involved with outside? What are your hobbies, interests outside of medicine?
Yeah, so my prior job was at Kaiser Permanente, where in addition to being a clinician, I had lots of administrative duties. And next thing you know, the decade goes by and you've been all encompassed in work. So I made the commitment to try to take a better care of myself and give myself permission to enjoy myself. So I used to play a lot of golf, and so I'm going to be taking that back up again.
Good for you. And this is a great area for that, isn't it?
Absolutely.
Wonderful. Well, we really enjoy hearing about your personal life, but we'd like to understand a little bit of your personality as well. So this is the lightest part of our presentation, and that is a little game we call This or That. Are you ready?
Okay.
Stream of consciousness. Don't have to think about it too much. Dogs or cats?
Dog.
They're winning today. Early bird or night owl?
Night owl.
Time machine or magic wand?
Time machine.
I like that. That's my choice. What's worse, laundry or dishes?
Dishes.
Skydive or bungee jumping?
Ooh. Neither.
You're the second one I've heard today say that. Ocean or mountains?
Mountains.
Nice. For casual wear, sneakers or sandals?
Slipper.
I love that. Passenger or driver? Let me guess.
Driver.
Yes.
But only so I can control the radio.
Oh my goodness. And finally, superpower. Be invisible or read minds?
Say read minds.
Oh, you're adventuresome. I like that. Well, the last question I did want to ask you, where's your practice located?
Yeah, so I'm based out of two offices. My Ventura office is across the street from Community Memorial Hospital. And I'm also in Camarillo, currently 6 days a month. And that's off Pleasant Valley Road.
Good. At the Center for Family Health there?
Yes.
Wonderful. That's wonderful. Well, thank you so much. Really appreciate it. Thank you for tuning in to learn more about Dr. Poon. For more information on all the services and specialties offered at Community Memorial Health System, visit cmhshealth.org. And be sure to like and subscribe for more from your community health system. Thank you, Dr. Poon.
Thank you so much.
You're sure welcome.